Did you know that nearly everyone will experience some form of impairment at some point in their life? In fact, the World Health Organization reports that 1 in 7 people worldwide has some form of disability, and 80% of these people live in low and middle income countries. In South Africa, the demand for rehabilitation is growing due to the quadruple burden of disease, which is HIV and TB, chronic illnesses and mental health, injury and violence, and maternal, neonatal, and child mortality. And with an aging global population and the rise in non-communicable diseases, the need for rehabilitation is growing more than ever. Rehabilitation is a critical component of the healthcare that addresses both the physical and the holistic needs of individuals with disabilities or impairments. However, defining and measuring its true value remains a challenge. So our research aimed to define the value of rehabilitation for physical disability in South Africa. We try to do that at the primary healthcare level in the public healthcare sector. Our project aimed to provide contextual evidence of the benefits of rehabilitation to stakeholders such as policymakers, funders, academia, healthcare providers, and the end users, including patients, families, and the communities. Our project involved 3 phases, which entailed interviewing rehabilitation stakeholders, reviewing South African healthcare policies, as well as retrospectively reviewing rehabilitation record patients with physical impairment. So just to provide some background in terms of the literature, we've identified that there are certain value determinants that are often used in the literature to determine and calculate the value of rehabilitation. These value determinants include health outcomes, costs, patient-centeredness, quality, safety, and best practice. These value determinants we used as the basis or the framework in which we try to define the value of rehabilitation in the South African context. So in phase 1, we found with the interviews of the rehabilitation stakeholders that their opinions align with the literature, with the most prominent value determinants being health outcomes, costs, patient-centeredness, quality, safety, and best practice. The rationale was that when the patient is at the center of how value is determined and calculated, every stakeholder involved in the healthcare of the patient benefits. In phase 2, we reviewed South African healthcare policies, and we found that the South African disability and rehabilitation policies actually align with the value framework. So it actually could identify with all the value determinants that we've identified from the literature. However, it was not the content that was the problem, it's more the implementation thereof. In phase 3, when we did the retrospective record review, we found that there are certain value determinants that could be identified in the patient records of patients who've received rehabilitation at certain primary healthcare sites. However, there are variables that were not documented. The variables that were documented include the type of treatment that was received, the outcomes that the patients were working towards, and the providers that were involved. Some of the undocumented variables that could be helpful are, for example, any costs that were involved, any costs involved with home visits, and any other costs that were involved in the treatment that could inform the value of rehabilitation. We did find that addressing these barriers can be achieved through better collaboration between government, policymakers, and the rehabilitation sector. We also find that re-energizing the focus on the patient's needs and enhancing undergraduate training programs could also improve the collaboration between the disability and the rehabilitation sectors. In terms of the policy, we know that South African healthcare policies have been developed with good intentions. However, failure of policy implementation can be attributed to the lack of investment and appointing experts with no experience in public policy processes or implementation. And we find that involving rehabilitation stakeholders, and especially the end user or the client, in the policy development could strengthen the uptake or implementation of the policy. The other important factor to consider when determining the value of rehabilitation is using outcome measures consistently and appropriately. Unfortunately, allied health professionals often resist using outcome measures despite its benefit in demonstrating the value of the treatment and educating the patient. Without outcome measures, we are not able to demonstrate the value of rehabilitation. The other important factor is the role of the healthcare provider. We know that rehabilitation rehabilitation professionals play a crucial role in determining the value of rehabilitation for persons with disabilities. A multidisciplinary team can enhance the quality of care, especially for patients with complex needs. Some of the South African healthcare policies define an ideal core rehabilitation team. However, in practice, that does not always exist, with many a time only the physio and the doctor being present. There are some facilitators, or there are some factors that can actually enhance rehabilitation or the value of rehabilitation. And we know that in South Africa, rehabilitation is an established service because it's provided at all levels and it aligns with WHO recommendations. Collaboration between healthcare professionals and other sectors, resource development, and good research are key to value-based rehabilitation services. So the lessons we learned from this project include that there are different value determinants that need to be considered when we're looking at the value of rehabilitation, or when we want to define and determine the value of rehabilitation. We've identified that all of these variables, or many of these variables, can be identified in the South African context, and that was through the opinions of the stakeholders, through the policy review, as well as the document review. However, it's not the individual value determinant that decides or that determines the value. It has to be brought together, and especially in the South African context. These findings are especially relevant and important today as South Africa is transitioning to a national health insurance and in the pursuit of universal health coverage. So going forward, we propose that and we encourage a collaborative effort between provider and patient, involving the patient in decision-making processes, documenting and measuring outcomes consistently and appropriately, and participating in clinical practice guideline development and research to improve costs and improve health outcomes. And the most important is collaboration, not just within the healthcare professions, but also with policymakers, funders, and any other stakeholder that can help to improve the healthcare needs of patients with disabilities.